Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and today is October the 28th, and this is another of our COVID conversations. We're very pleased today to have a guest with us today. Dr. Paul Lewis is a colleague of mine for, many, many years now. He's a pediatric infectious disease expert at the university, and he has saved my bacon so many times when
Vice versa.
And so we worked together over lots of things over the years. I think starting first with some of the first HIV patients that we've had here in the state, and now we're working together on COVID. So I'll start off with a briefing telling how things are going throughout the world with COVID, and then Dr. Lewis and I will discuss some topics of interest. We've gotten a bunch of questions this week. Most of the questions have been about boosters, and Dr. Lewis and I will discuss boosters for you. We're also gotten questions about pediatric vaccine, and there's probably no one in the state who is more knowledgeable about the vaccines than Dr. Lewis. So COVID is still really quite an issue around the world. Although the number of cases is slowing this fall, we're seeing a lot of cases in Eastern Europe and in Russia. So Eastern Europe and Russia are having some of their highest case counts ever and some of their highest hospitalization rates. Mostly what they're seeing is the Delta variant, and the Delta variant is pretty much the variant all around the world. We'd worried about the Mu variant and some of the subvariants of the Delta, but it really appears to be all Delta all the time at this point. We've also seen a fair amount of disease in Mongolia, sort of an unusual place. We're still seeing some disease in Central America, South America, and in Africa, but no real big outbreaks in those areas, and that is a good thing because many of those areas of the world do not have very much vaccine. So in our country, we're about 50% in Douglas County, above that in the rest of the state. But in many of those other places, they've had very low rates of vaccination. So we do worry about this disease spreading to those poorly vaccinated areas. In the US, our number of cases down, and finally our number of deaths is starting to come down, although there are still hotspots in the country. In Utah, Idaho, and Kentucky this week, they reported that their hospitals were overloaded and we're calling in the National Guard and others. Just as we were about 6 weeks ago, they're now in that sort of crisis mode as patients who've been sick over the last few weeks get sick and then really sick and then wind up in the hospital and then in the ICU. In Oregon, the number of cases is flat. Actually, I think it may be going up this week. We did have our big peak in August and September and then was down in October, but we're starting to see more disease now. And we're starting to see more disease, especially in Eastern Oregon and in those few counties in Western Oregon that have low vaccination rates. Again, when I look around the country and look around the world and look in Oregon, you can really correlate places that are having more disease with less vaccination. I think the correlation is incredibly clear. And so Douglas County, having a lowish vaccination rate, is still seeing a moderate number of cases. The hospitalizations, which were such an issue for us in August and September, have now started to clear out. The hospital count in Oregon is about half of what it was at the peak, but it's still almost at an all-time high. So when you think we had a big peak in January and February of this year, and then it came down to very low levels of hospitalization, about 100 or 200 people in the entire state in the hospital, then went to well over 1,000. We're still now in the 400 or 500 range, which still is a lot of people in the hospital. And a lot of those people have been in the hospital for a very long time. In Douglas County, we continue to have a fair number of cases. Actually, they're going up again. So we peaked at about over 150 cases a day. Then we went down to the 30s, and now we're back up to the 40s. Again, almost all of these cases we're seeing are among people who are not vaccinated. So your risk of getting the disease is 6 times higher if you're not vaccinated than if you are. Your risk of being hospitalized or dying is 12 times higher if you're not vaccinated. So again, it's really obvious that vaccination makes a big difference. We are seeing a lot of people in the hospital still about 30 people in the hospital. Many of them have been there for a very long time. There was a person who was discharged this week who'd been in the hospital 70 days. That's a long time to be in the hospital. And it's going to take a long time for him to recover. And sadly, we've had a lot of deaths. We're reporting another death today, but we've had over 160 deaths. 160 deaths in Douglas County since the beginning of August. And when you remember that we only have about 120 deaths a month total from all causes for these 3 months to cause 160 deaths has really, really been a big toll. But I think our way out of this is with vaccine. And over the last week, what we've seen is that the FDA and the CDC and the state approved the use of booster vaccines for Pfizer, Moderna, and J&J. So anybody got a vaccine could now get a booster. Now, boosters have been a little controversial, and this is where I like to bring Dr. Lewis in. Clearly, around the world, boosters have been somewhat controversial, and they've been controversial because the additional protection with the boosters is small, but there are a lot of places in the world have had no vaccine at all. So when we use vaccine, and especially when we waste vaccine, so somebody comes in for a booster, we use a dose. If nobody else that day comes in for a booster, we can waste 13 doses of vaccine. So morally, there's a question about whether we should give in boosters in the US to give a marginal benefit when other people in Africa, Asia, South America have had no vaccine at all. So Dr. Lewis, tell us what your take is on vaccine.
Well, yeah, I think with regard to the booster, you raise a lot of good points. Unfortunately, neither you nor I have the ability to set national policy about distribution of vaccine. So I think we always have to tend our own garden, which is here in the U.S. and in the state of Oregon. I think both the FDA and the CDC were pretty clear that the actual recommendation, like you should do it with the booster vaccine, was actually fairly limited. And it was really limited to those over 65 who've always had the highest risk by far of severe COVID, as well as those who are over 50 who have the underlying medical conditions that put them at higher risk. So again, certainly everyone asks me, I'm sure they do, you too, Bob, what should I do? What should I do? And for those two groups, I think it's a really clear answer. The recommendation for people with medical conditions under 50 and for the general public over 18 who work in a place or live in a place that might put them at higher risk was much softer, actually. We used to call it a permissive recommendation. They wanted to make sure the door was wide enough open for those people that wanted that, as you called it, a marginal additional bit of protection could get it, but they weren't recommending that everybody do it. But it is an option for those that make that choice.
Yeah, and so we're giving boosters here. There are about 30 places in Douglas County that are giving them. Most of the pharmacies, all of the big clinics, and many of the even smaller doctors' offices are giving these. So if you're in one of those groups, 50 and above, or 65 or above, or 50 above with underlying conditions, we'd strongly recommend that people get it. And then for people who are less than that, again, if you want to get it, nobody's going to stand in your way. But the marginal benefit is small. The way I sort of explain it is, if you have a town that has no fire station, adding the first fire station really does add to the protection in the community. Adding the second fire station costs just as much as adding the first one and provides a little bit of benefit. By the time you get to the 9th or 10th fire station, the marginal benefit is small, but the cost remains the same. And that's the way it is with boosters. So we are recommending for people 50 and above with medical conditions, 65 and above, to get those boosters. And I think the data shows that no matter what you got for the first, you can get a booster of any other kind. And so if you got a Moderna, you could get it, any of the three. If you got a J&J, the recommendation is that everybody who got a J&J, and in Douglas County, that's about 5,900 people, we are recommending that those 5,900 get a booster regardless of age, because we've seen the J&J be underperform a little bit. So when we look at our breakthrough case and our hospitalizations, over this time, we're seeing that although they made up only about 10% of the vaccines, they made up about 15 or 18% of our breakthrough cases. And so the J&J being a single dose probably didn't give us good protection in the beginning. So we'd recommend that those people get a booster. The other big question is about pediatric vaccines. So what do you think about that?
Well, we should have another conversation next week, because it's a two-stage process for the approval by the FDA and then the recommendation by the CDC. So the FDA panel approved a Pfizer product, smaller dose, 2-dose series for children aged 5 to 11. And with that authorization, it means that anyone over equal to or over 5 years in age can be vaccinated now. The great news is that they did a little upfront work and they figured out that you got the same bang with 1/3 of the dose and fewer side effects. It was equivalent to the next age group up, teenagers. So they went with that dose, and they did the usual thing where they divided the group up. Some got the vaccine, some didn't, and they found very similar to the vaccine in older age groups that it was about more than 90% effective at preventing symptomatic infection. And that means that if anyone in either group got a cold, a runny nose, a fever, stuff like that, they tested them. And again, there were far fewer cases in the vaccine group than in the group that got the fake shot.
Well, that's good. Well, one of the concerns that I hear from parents is, do they really need this vaccine? Kids don't get very sick. And what I tell them is, even in my small world, I've seen quite a few kids with COVID. One who was sick enough to be in the ICU up at Dornbecker with COVID on a lot of oxygen. He wound up not getting intubated and has recovered. But then I've seen a bunch of other kids who had COVID who were just miserably sick, like a really, really bad cold thing, not sick enough to be hospitalized, but many of those kids are still sick weeks later. So one little guy I take care of just feels like he can't get a deep breath in. We've had other kids who get the disease and then are like Sleeping Beauty, sleeping 20 or 30 hours a day. Thank God we've not seen any of this MIS-C syndrome, but I know, Dr. Lewis, you've seen some, so tell us about that.
Right. I've got 2 in the hospital right now and sent one home last week. So unfortunately, this is a real thing. It's a little funny. I'll tell you what the parents this morning said, well, if she wasn't very sick when she had COVID, why is she so sick now? And I said, oh, good question. What seems to happen is that, like all kids, and these are usually school age children, so I would say K through 5 is the peak age group. They either didn't ever know they had COVID, or their brother and sister had it. They never got sick, or maybe they had it and got tested. And then 4 to 6 weeks later, for no apparent reason, they develop high fevers and aches and pains. Sometimes they get a rash and red eyes, and then the blood tests show that things are really revved up inside, often including some damage going on to the heart. And what you have to do for these kids is you have to kind of turn the heat down. Their body is overreacting for some reason to having had COVID a month earlier. So we have to use some, medium duty artillery to turn things down. So we give them a blood product called intravenous immune globulin. We give them medium to high doses of steroids, things that adults might know about, like prednisone or methylprednisolone, and sometimes even to fancier biologic things, all to try to turn the heat down and to limit the damage to their organs. So that's a pretty serious concern. Can be a tricky diagnosis to make. Last I heard, there'd been 40 or so cases in Oregon. They're all sick. They tend to stay in the hospital 5+ days. And then I have kind of a long tail after that where they still need to continue to receive medicine and follow up. And then just because it's been, it's the peak, it's not what we didn't expect. We had a teenager last week severely ill with COVID that we pulled everything that they had at the pharmacy out. And she did recover, but it had us pretty anxious. And then finally, you mentioned people recovering slowly. And my colleague here, Dr. Vaz, and works with a group on a multidisciplinary clinic. In adults, it's been called long COVID. It's less well defined in kids. But those of us who work in pediatrics know usually when kids get over something, they're ready because they're just bouncing off the wall and ready to go.
Absolutely.
So if you've had something and you're now like sleeping all the time or unable to do your activities, that's not normal. And so COVID's a little different that way. There's very, very few illnesses we see in pediatrics where the kids just don't, rubber ball it back up and get back to normal. So that is a concern. And so parents making the decision might want to factor in things besides just the fact that the initial illness might be mild and that it could last longer, or that there could be this unusual autoimmune complication?
And while in general it's less, there are about 700 kids in the country who died of COVID. And so that's a lot. Kids don't die for many reasons. And so, for example, with flu, even in the worst year, we only have 100 or 200 kids die of the flu. So this has been much, much, much worse than the flu. The other thing that we see, with this is that the myocarditis from the disease can be moderately severe. But you can also get myocarditis from the vaccine, although I think that was not seen at all in the studies on the 5 to 11.
No, good point. The study, though, didn't claim to be able to detect a side effect that's that uncommon. The current estimate is somewhere between 10 and 100 cases of the heart inflammation per million doses of vaccination. So pretty darn uncommon. We've seen a bunch of them, unfortunately. They're pretty quick, though. They usually get better with something like Advil, sometimes a little bit more, and out of the hospital pretty quickly. The myocarditis directly from COVID, however, is a bit more raging.
Yeah.
And again, you'd certainly pick the mild version over the raging version if you had a choice. And again, the parents, need to think carefully about this, and that if there is ongoing surveillance, if and when the vaccine's been gotten an authorization, the CDC will make its recommendation. Most people expect that the first week in November, it'll start to become available, and monitoring for rare side effects is always ongoing after a vaccine rolls out, just as it was with the adult vaccine.
And one of the ways they do this is that there are several large insurance companies in the U.S. that put together their data, and then they look to see for people who got the vaccine versus for people who didn't get the vaccine, are there some things that are more common or not? And actually, they found there are some things that are more common. So, for example, people get the vaccine are more likely to have a swollen lymph gland in the arm where they got the vaccine. And the data picked this up, that this was one of the things they saw. But the other kinds of things like problems with fertility or heart attacks or strokes or whatever else really had not been seen in the data. So we're as more and more data comes in, it's more and more reassuring that for the people who've gotten the vaccine so far, it's safe. And there's nothing to think that for kids 5 to 11, it won't even be safer. Kids 5 to 11 are really at the best part of life. As a pediatrician, there's lots of things that happen in the first 2 years. I call them like when you get a new car, there's little things that go bump and you need to get it fixed. But boy, once you're 5 to 11 years old, usually all those things are kind of straightened out. These kids are incredibly well. When I do a well visit on a 9-year-old, it's like there's nothing to talk about because you're so healthy. And so we expect these kids to do very, very well with this vaccine. So one of the other questions that comes up with this is about other diseases that we expect to see this season, like flu. And do you have any ideas of what was going to happen with our flu season this year?
Well, we know what happened in 2019, 2020. We had a normal flu year. And then last year, because of all the limitations on activities and people's concerns about gatherings, there was a almost absent flu year. So this year is expected to be something more like normal. Most people, myself included, are really tired of the limitations, and I think it won't be a surprise if people do get together more. And I think they're not going to spread as much COVID because most people have either been vaccinated or had the disease, to be honest. But again, flu never goes away, and it finds susceptible folk, and we're all susceptible each year because it's such a good shapeshifter. So again, I think without letting our guard down, the best thing you can do to avoid influenza, and I've had real influenza, I don't wish on anybody, is to get your flu shot this year as well. And I think as you lean into the holiday season, I think you'll be more confident, and also, especially if you're seeing more vulnerable family members or seniors, it's just a little gift you can give them pre-season to help protect them.
Yeah, flu is really a memorable disease. I almost never get to take a day off for being sick, but 4 years in the 40 years I've been a doctor, I got the flu. And those were in the 4 years where there was not a good match to the vaccine. And flu is a very memorable disease for somebody who basically never takes a sick day. These were the only sick days I've had in the 40
Yeah,
years.
me too. I mean, you're on your back and getting to the bathroom's a success.
Yeah.
So
So let's stop
don't
that.
get it.
So we have plenty of flu vaccine. The flu vaccine we think is going to be a good match, although only time will tell on that. But get your flu vaccine, get your COVID vaccine, and if you're in that high-risk group, please get a booster. All right. Well, thank you, Dr. Lewis. This was great. Maybe we will have you back next week. But thank you for joining us.
All right. Thanks for having me. It's great to visit with you guys.
Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County for October 28th, 2021.